Hey folks, Brandon Odo from EMSBasics.com. I just want to give you a quick little trick that I've come up with. We'll sometimes talk about, especially patients who have foreign matter in their eye, some kind of eye injury, often burns, especially maybe a chemical burn, some kind of material that's still on the skin. Occasionally maybe an injury with some foreign matter in it. You just want to do a kind of rough debridement of the area, get some of the junk out. We'll talk about irrigating an area with water, and we usually carry some sort of sterile water for this. If you work in a BLS unit, you probably have something like this around. It's just a bottle of distilled sterile water. Sometimes you'll see saline instead, but same idea really. And it's well and good to talk about irrigating these areas, but usually what you'll see recommended is really long-term irrigation. It's not just splashing water on there. It's saying for 30 seconds, a minute, 5 minutes, 15 minutes, you're going to want to keep flooding the area with water. And I don't know how you're going to maybe irrigate an eye for 15 minutes using one of these bottles. Usually they just have these screw-off tops, and the best you can do is kind of pour water on them. But if you're pouring water in an eye like this, it's not going to last you very long. It's going to make a mess. So what you really want is kind of a low flow, continuous stream of water, and that's tricky. The medics usually have ways of doing this. You can set up an IV line and kind of flood it continuously into the area. I've seen tricks like connecting a nasal cannula to a bag of saline and letting it drip into someone's eyes. For us on a BLS unit, it's not as easy. So this is what I've come up with. You have one of these bottles. You take just a knife, something with a tip, and you can actually drill a hole into it. And what I think works is going right into the top here. It's tempting to go somewhere else because this is pretty thick plastic, but it's thick everywhere else too, and it'll be less convenient. So what you can do is just sort of awl a hole into here, and don't hurt yourself. But with a little effort, a little perseverance, you can just drill a little hole, and the result is you have a bottle with a kind of a squeeze tip like you'd have on a sport bottle, and you can produce a continuous stream of liquid which you can aim and you can kind of gently squeeze, and you can do this for a while, and it's really just what you want because you can put it where you want it, and you're not going to run out anytime soon, and usually you have a number of these bottles so you can keep going for a while. But if you ask me, this is what you want if you're going to irrigate something. If you don't make the hole exactly right, sometimes it sprays in 3 or 4 directions, but you can usually touch it up a little bit. And really it takes nothing other than a knife, which most people do carry, and in my opinion this is the sort of thing that it's useful for. Cutting usually I think is easier with shears, but drilling, scraping, slicing, that's what it's handy for. So, something to think about. Give it a shot. Let me know what you think. Brandon Odo from EMS Basics. Have a good one, guys.